huge thanks to all of you for joining us. Thank you to Dario for the invitation. I'm going to get our panelists kind of to do a quick intro to themselves, but I will say that I'm really excited to be able to join a conversation with these guys. They're both people that they're all people that I absolutely their lives, not just because they are doing some great things in our industry, but because I think these guys keep it real, for want of a better word, and hopefully you're about to see some of that. I will let you know right from the outset that Maggie unfortunately has a hard stop at past, so may need to disappear just before that moment. But you might
ask me hard questions before that.
We'll ask you the hard questions.
Or save them for Manuel or Raz.
No, we'll make sure you get them all right before you go. Don't you worry. Let's do a really quick round robin introduction. Let's keep it to a sentence each, if that's all right. Manuel, why don't you go first?
Hi, I'm Manuel Ryberg. I'm the MD of Digitisation UK. Super passionate about healthcare, the current transformation, and the social responsibility of our industry to drive and to work towards more sustainable care. And that's what we partially will talk about today as well.
Wonderful. Raz?
Hi, everyone. I'm Raz, Chief Revenue and Growth Officer at Okra. And like Manuel, super passionate about the industry in general, but specifically on technology that will drive digital transformation. And we don't just talk about it, we actually do it.
So you're already in the top 1% then. That's good to see. And Maggie?
Hey there, my name is Maggie Peterson. I'm a Field Vice President of Sales at GlaxoSmithKline in the US business. And like my colleagues, I'm really passionate about how technology is changing our industry, as well as how we continue to create a more diverse and inclusive culture within our organizations that's reflective of the patients we serve.
Fantastic. And you also have a fantastic kitchen. Okay, so now, Manuel, I thought I'd pick on you to begin with, not in a bad way, but because actually this is a special week for you. You've just made a great announcement about a partnership you've made at your company. The title of today's session is, I believe, Pharma is from Venus and Tech is from Mars. If you're familiar with the I wouldn't like to suppose that anybody listening has ever had to get any relationship advice, but if you have, you'd probably be familiar with this book. It's a classic, and it talks about how, of course, the two genders often speak different languages, and of course, pharma and technology also speak different languages, but there is beautiful, sweet love that can be made, as far as I'm aware. So, Manuel, let's hear an example of such beautiful love.
So, Paul, thanks for touching on this. Yeah, I'm as well as Raz. I'm very passionate about tech, and I'm very passionate about the fact that I believe we need stronger collaboration between tech and pharma to provide solutions to some of the most fundamental challenges that we currently face in our healthcare system. That is capacities. We've got long now waiting lists. Obviously, COVID hit, that even further accelerated this. But we started already last year an initiative whereby we sort of invited, for example, tech providers to our meeting to explain what solution they could provide. They really integrated in our sort of conference in order to better understand how we can sort of work closer together. And that goes beyond just providing money and to ask somebody to do something rather than making it an integral part of our business model. And I'm, as you alluded to already, absolutely delighted that we have sort of this week announced a transformational partnership between ourselves, FibriCheck, NeoHealthTech, and Capital Medicare to really fundamentally address some of the big challenges in atrial fibrillation, and that is the rate of detection. We've seen a shocking fall in detecting AF patients in the UK. We know that, as I said already, we've got massive waiting lines for the NHS. We have got very clear capacity constraints, and we found a way to work collaboratively with all those three companies to redefine remote AF detection pathways that can offer a real solution to address that issue of AF detection, which ultimately then can drive improved patient outcomes. We hope we can avert over hopefully 12,000 sort of strokes, which we would probably hit if we don't do anything. And I think COVID has shown that overall tech collaboration and the need to provide sort of new ways of working with the healthcare system in order to ensure sort of opening up capacities and making sure that we drive towards more sustainable pathways will hopefully lead to more creative situation and solutions. And I fundamentally am a believer of our NHS and the support of this. And I think we can do offer a lot more solutions beyond just offering our treatments and medications, to be honest.
Yeah, so Manuel, for the couple of years that I've known you well, you've always put yourself in the NHS's shoes and really shown yourself to understand their needs as your core business driver. And I think actually what you're describing here is just the latest iteration of having that philosophy. But of course, there'll be people listening in who say, okay, great, you're saving us from having 12,000 strokes. You're doing something innovative. You've got new partnerships. Very exciting, but how the hell are you going to make money out of this? And so I'd love to just hit that with both barrels, if it's okay. What's the commercial rationale for this?
So it's, one of our core strategies is to become the partner of choice for the NHS. And I believe by doing so, you will become one of the core sort of providers of the NHS. And that fundamentally leads into commercial success, as we have seen sort of already. I really have put the challenges of our healthcare system at the heart of our strategy. And since I joined the company here in the UK in September 17, we've seen exponential growth of our business. But the core was that we really try to understand what the local healthcare challenges are, to really work collaboratively with key decision makers and the local NHS in order to address some of those challenges. And that's sort of been rewarded incredibly. I think we've developed superbly constructive relationships in an environment where we know it's a very challenging and an environment under a lot of budget constraints, but we acknowledge this and we carefully listen to sort of develop a value proposition that is so compelling and goes beyond providing our pills, but equally includes this. And therefore we've seen extraordinary exponential commercial success by doing this, because I think we had very genuine approach to this. It's not lip service. I really put it at the heart of whatever we do, and everyone in our organization has to become, our account teams have to become local NHS experts, because we are exposed to such a complex system. And I fundamentally believe we cannot solve those problems alone. And we, regardless of pharma or whoever we are, we have a duty. We are ultimately taxpayers and patients to make sure that we work in one direction that can sort of have a positive impact for, as I say, more sustainable healthcare system, that we leave a system and access to high quality healthcare for the next generation.
Great. No, sounds fantastic. Maggie, I'd love to come to you, hear what you think about that. Is it something that you believe that other companies can follow? Have you got experiences of that depth in your own experience?
Yeah, so I do think it's a model that other companies can follow. And I think what particularly resonates with me is this theme that I think's implicit in Manuel's comments around trust and the importance of being a real partner to the NHS, or whatever your NHS equivalent is in whatever market you're in, and thinking more laterally around how we drive growth and performance of our companies by being a better partner and leveraging different technologies and ways of working with local healthcare to make that happen. I think GSK has started to do some of that in different capacities in the US, certainly in the UK. And I think we're on the cusp of kind of defining what some of these new types of partnerships could look like, and leveraging artificial intelligence, machine learning, and kind of different ways to ultimately better support patients. So I'm really excited to hear examples like Manuel shared that I think can be an inspiration for all of us. Paul, you look like you've temporarily disappeared.
Yeah, I am actually still here. I've just got an issue with my camera. You're just going to have to imagine the beautiful sight of me asking you questions, but unfortunately can't provide it. Thank you, Maggie. I appreciate that. Raz, you are a technology company. Okra is a really exciting organization, in my opinion, actually changing the way we think about AI and taking it in a much more human way. What do you think when you hear of all this talk about partnerships, bringing technology companies in as partners? Is that something that you actually see happening, or is it theoretical at best?
I think there's probably three ways to look at it, Paul. Could we be more open? Could we be more honest? And does that lead to kind of the collaborative relationships that we're all aspiring to get to? So I think, today conversations are definitely more open than they were before. You've got, global innovation competition, startup labs, and all these kind of initiatives that are bringing new technology and ways of driving patient outcomes to the forefront. But ultimately, when it comes to scale or preferred suppliers, etc., I don't think it is as open as it could be. There are still huge barriers to overcome, certainly when you're up against incumbents. And then really to go beyond kind of that POC company or that pilot company, it is very difficult, even if you have the best tech, even if you prove value, even if you prove change management, it is still very hard. So from the outset, you can be put into a box almost as an innovation exercise. It sounds like, Manuel's process at Daiichi was one that was very thorough and avoided that. But if you are a kind of working with no real intention of the client, leading to scale, it is a little bit disconcerting. So I think there is a play about kind of transparency play, really, in the decision-making process that can lead to and harbor better collaboration. So, for a tech, from a tech point of view, we very much enter into partnerships where we live and breathe, the data, the challenges that individuals face. You alluded to the NHS and AF, and looking at, all the various maybe disease prevalence, social, economic information, demographic information, take that into the collaboration, but also there for pharma to recognize and include maybe vendors earlier on in their own plans prior to, even contracting conversations, even starting to really, I think, enable that tech and client relationship to be closer.
Yeah. So Manuel, what's your sort of partnership philosophy, if I can call it that? Like, if I was to get you to write the next Pharma from Mars and Techers from Venus book, what would your key message be about how to do that?
Maybe quickly touching on sort of coming to your point in a sec, but touching on Raz's point. So I think, okay, and coming to your point, so our philosophy, and we're just building about to sort of, first of all, recognizing that the world is changing, and that we need to sort of evolve our business model. I guess that's a first important sort of recognition that our ecosystem is changing and our landscape is changing. We are exposed to huge complexities. I don't think that pharma necessarily can solve all this, and if so, I think it requires a lot more specialized approach, clearly calling on tech to support us in this journey in order to process some of the information that we obviously get through Twig. So the one thing is there is a big sort of knowledge gap around which companies are at all existing. So we need to start a thorough sort of a scouting approach, Raz, and you need to put yourself on the map, and we need to further better understand what the offering is. So that's one thing. It's actually the knowledge of your existence, and I only found out very recent about you guys, and you've got a very, very interesting value proposition, and you seem to be a very smart bunch of people. So we look for what can be offered. It's about aligning our intent and what are we trying to achieve? There is a lot of question for me. What type of shared values and culture do we have? Yeah, what is our shared aim? Can we line up a triaging not only with us? Is it tech? Is us and the system together? I fundamentally believe that we need a more integrated approach. I see pharma and our ecosystem or us becoming an integral part of addressing of some of the fundamental challenges that we face as our society, and that's beyond obviously climate and food supply, is access to high quality healthcare. And I think to acknowledge this and to then go the step in order to sort of understand what the individual pain points are, what are the pain points within the patient pathways, do we see inefficiencies in the system that we can address through, you know, those collaboration? Can we even save money by driving those inefficiencies or addressing those that then can be reinvested, for example, into innovative drugs? Yeah. So this is why I see it more as a virtuous circle of a fundamental need of driving those collaborations, obviously aligning on the things I said, to then address those inefficiencies and process inefficiencies, to then drive efficiencies and saving money, and then reinvesting that in better care. We're not doing this for the sake of just saving money. We're doing this in order to provide better care, in order to provide better patient outcomes. That must be always at the heart of what we do. And this is what's essentially driving us.
Go ahead, Maggie.
Yeah, I think what you say, Manuel, really resonates with me. I think the kind of starting with the recognition that the ecosystem's changing and, you know, where the world is moving towards, and how do we evolve our business model to be kind of relevant and in line with actually what both customers and patients expect. And I think then in your diagnostic approach, understanding like where are the pain points, as you say, where are the pain points for patients, where are the pain points for our customers, whether that's in the NHS, for example, as a system, or whether that's in individual customers that we're working with on a rep level, and being able to come up with solutions that we can learn quickly from, fail fast where necessary, and then have scalable potential. But I think as an industry, we typically tend to follow this mindset where everything has to be the whole kind of 9 yards, and we want to do everything in a kind of typical waterfall methodology instead of having a much more kind of agile sprint mindset. And I think that's what this transformation needs.
So what's stopping us having that, Maggie, if I can stay with you for a second longer? Because, you know, I remember you said at the beginning you want me to make sure I ask you the hard questions before you go. What's actually stopping us getting there? What are the actual barriers that are preventing us from doing that? Because I reckon that the vast majority of people listening to this will be nodding their heads with what you said, yet it's
violent nodding.
Violently nodding, yes. Yeah. Yet when we actually try to do it, we are, I mean, I imagine that technology partners don't consider us to be the most agile of partners in reality. So what are the steps that we can take?
Yeah, I mean, I think typically we've been, how do we say, a pretty risk-averse industry. What I've been actually really encouraged by, and what has, I think, been a silver lining of COVID, is that we've been forced to think differently about how we leverage technology to provide a more holistic customer and patient experience. I mean, for example, some of the work that GSK and other companies have done around direct-to-patient sampling, so that patients can get samples of much-needed medicines without having to risk exposure to COVID going into the physician's office. I think what gets in the way of some of these things is, frankly, inertia. Like, if it's not totally broken and there's no burning urgent platform to fix it, you have a company of 100,000 people doing something a certain way for a long period of time, and then you extrapolate that across the entire industry. I think it makes change quite difficult. And then when you have a disruptive force like COVID that forces the issue, that's where change becomes a bit easier. I mean, I'm curious for Manuel's reaction to that and Raz's view as well.
Yeah, well, necessity is the mother of invention, and if you don't have any necessity, then you don't change. So is it that a boiling frog won't jump out of the pan if you raise the temperature slowly, but it will if it does it very quickly? Do we need to literally burn the platform down in some way?
I'll just echo something that Maggie said about the whole 9 yards, right? So, and I've listened to quite a few talks today, and a number of times I heard, we need our data in order. We need our house in order. We have to have everything ready before we even attempt to do something. And if I tell you as a company, the biggest successes we've had, and in terms of accelerating a company's digital transformation, has come when the data wasn't in order, when the house wasn't in order, because we were able to then identify the gaps quicker. We were able to then prove value and then encourage the change management that was required in order to then invest in the gaps that were identified in that process. So you can argue about getting everything in order first and then trying to go the whole 9 yards and have the perfect solution. But the point is you're not just being fit for today. You need to be fit for today and fit for the future. And to be fit for the future, you need to start today. And then you need to start capturing all that. So embrace the uncertainty as we do as humans. We embrace uncertainty every day of our life and we navigate it. How? We draw on past experiences that guide us through that uncertainty. The wisdom of the past helps us navigate the future. And it is no different with these systems. The bit that I will add, though, is that different functions of pharma. So the commercial function, very used to systems, very used to technology, very used to disruption. Therefore, I say radical transformation, the resistance is lower. Medical, not so much. It is the up and coming area where technology innovation is now really starting to put MSLs at the fore and so on and so on. And value access and pricing, the resistance is through the roof. Therefore, don't even try for radical transformation. It will be incremental. It will be probably where pilots are more suited. But that for me is how, what we've seen as a provider and how we try to navigate through what is a very complex web of...
Well, that's interesting. A real variation there in a propensity to engage and to welcome disruptive solutions. It looks like Maggie's had to jump, as I warned she would. That's not a problem. But I guess, Raz, I want to stay with you a second longer because what really interests me is not only that you're saying we don't need to be ready before we engage, and that's a fallacy. In fact, engaging earlier might help. I'm sort of almost thinking back to the whole relationships thing. Do you need to sort of be ready before you go out there and start looking for someone in your life? I don't know. Or does it just happen spontaneously? Probably the latter happens more often, right? Or at least it used to in the days before online dating. But you guys are a company that is actually designed for an uncertain world, as far as I understand. So can you just explain about your attitude to uncertainty for a second?
Yeah, I think simply put, it is all about embracing it, right? So we know that not all the data doesn't exist today to answer all the questions, right? We don't know, taking AF, for example, the knowledge of having kind of all the CCG knowledge, the practice knowledge, what is in QOF, who's been risk assessed, who hasn't, where the warfarin patients are. For a human to consume all that information is practically impossible, right? So let's embrace that human uncertainty. Let's allow the system to come along and support that decision making. But one of the things that will underpin that is this notion of explainable AI, okay? And we don't have time to get into all the subsets of AI today, but the explainability, i.e. the evidence that can be generated through this data to accompany those predictions or those guiding recommendations, has to be a fundamental part of anything that we start to deploy, because everyone keeps telling me it's change management and not technology, which is the reason for failure. Well, if it's change management, it's because people don't trust the output of your technology. Therefore, that has to be an absolute prerequisite with anyone that you start to engage with. So if we bring that capability to the table, don't tell us that you don't have what it takes to hopefully address the big elephant in the room, which is the change management or the adoption. So there is this confusion about what is it that actually pharma actually wants. And with some clients we go to, they absolutely know and they totally buy into it. With others, we'll talk about infrastructure and integration into existing tools. I get all that, simplicity, minimum disruption, but not all the existing systems that people have invested in are capable and are fit for the future. That is the fundamental problem here. So then which road do we go down? And that's then back to someone like Manuel to decide where that investment should go.
Manuel, very keen to hear what you say in response to that, and also how you feel that these barriers can be overcome in general.
Yeah, I couldn't agree more. It's more or less agreeing on what we want to address. Is it, they probably work in ways of developing or using the current situation in order to improve the way we interact with our customers. What are we trying to achieve? Are we trying to achieve to identify, for example, health inequalities in this country? Are we trying to achieve make transparent unwarranted variation in care across the country? We could use AI to do this and almost work on algorithms how to identify high and very high risk patients very quickly out of our system. So that's one area I think it's certainly interesting to explore. The other question is around how do we provide meaningful interactions with our customers? How do we better understand which both channel preferences and content preferences do they have in order to not honestly annoy them? Because we get to a point now, we still have a share of mind that we compete between us and probably a lot of competitors. The question is, how can we differentiate meaningful content, provide meaningful content in a way or in a channel at a time that the customer wants it? I'm not able to do this without technology and AI. And then the question is, how much am I prepared to throw our current ways of working overboard to say, forget about what we've done. What we've done in the past doesn't serve the future. And therefore, we need to acknowledge the fact that we need to radically probably change the way we operate going forward. But ultimately, it's about the attitude, the culture of individual companies. You've got probably companies which are more conservative, and you've got companies who are prepared to throw things overboard and say, well, let's start from scratch and build something new. And we as an organization I would probably describe us kind of being in the middle, trying to build on what we've done well and to really explore where we can improve and what we can do better and how do we embrace these new technologies in order to adjust to the new normal. And that is not going to go away. So we need to acknowledge the fact that I still always talk, people struggle about the fact that we are exposed to a twice exponential change in technological evolution. That's very, very difficult intellectually to grasp what that means. But it means you don't see a lot changing, and on the other day we are in a new world actually, and this is what I'm seeing coming. But we need to sort of be able to get people on that journey to develop that sort of vivid picture of the future, to start describing the funnel that we're working towards in order to make this more sort of tangible for individuals. What does care of the future means? Home care. It's the same with the video shop and this live streaming. Oh, my kids, honestly, guys, I mean, my kid's not watching telly anymore, and they say, I want instant content whenever, and I don't even write what I want to watch on YouTube. My youngest one, shockingly enough, is not even typing anymore. He's just using the dictating function of the Siri function to get whatever he wants. This is a fundamental behavioral change, which is so drastic already that it shows me on an everyday basis how much this whole healthcare situation will change as well. And it's nothing else. We need to apply these things into the future. So that's where we are, I guess.
Yeah, it's very interesting you talk about that. If you were to read a book like The Innovator's Dilemma, which I know you and I, Manuel, mentioned in a meeting yesterday, in that book he differentiates between two different types of innovation: sustaining innovation, just moving on incrementally, and disruptive innovation, which we've talked about a little bit today. And the problem is that if you listen to your customers, that's all very well in the short term. It's going to help you with your sustaining innovation. It's going to help you keep the customers that you've got right now. But all of a sudden, a new technology comes in, and at first it looks like a toy, as Clayton Christian said. So that's why Netflix, Blockbuster laughed when it saw Netflix, etc. But the truth is that these new technologies need to be taken seriously, and it's not necessarily our customers that are going to drive us there.
Correct.
So I'm just interested in hearing. We talk about customer centricity. We talk about being able to listen and incorporate our customers' requirements. But when you were talking about your kids using new forms of communication, kind of made me think, maybe there is a space where we need to design a new solution, where we need to welcome a new solution, maybe from a third party. I know that one of the people that you've made a partnership with, Manuel, allows you to check your blood flow through putting a finger on the camera of your smartphone. Very few consumers would have ever come up with that idea.
Exactly.
Right. So just interested in whether or not you think we as an industry are welcoming ideas from outside. If we are only relying on what our customers tell us, which is not a bad thing in the short term, but we're actually going to enable that disruptive innovation to enter our psyche.
I believe, Paul, on that note, that there are new ecosystems and obviously new tech emerging that will fundamentally transform even how healthcare systems will reimburse products in the future. Yeah, we are used to going through HTA assessments. We're used to sort of getting paid for drugs once we've demonstrated clinical effectiveness and safety through key pivot clinical trials. But does that mean that those products are working in all individual patients? No, it doesn't. So what we will see and emerging in the future is a lot more sensoring technologies, tracking of individual performance of drugs. We have a scarcity of resources. So we need to acknowledge the fact that we see sort of development in very targeted therapies, but they tend to be quite expensive. So we need to make them sure that if we pay for those therapies, or the healthcare system pays for those, that those therapies create the desirable effect in those patients in order to minimize sort of waste of resource. Yeah. And therefore, I believe ultimately reimbursement systems will change to pay for performance models. You will see this, but on instant. So 5G in itself, that technology will allow entirely different ways of operating. We will have people sitting in China, potentially a physician, having a remote surgery in the UK. You see completely new models of care emerging, and that's something that I believe we need to prepare for. And that's why I can only encourage everyone to spend a lot more time in exploring and understanding the levels of innovations emerging at the moment, starting a process of scouting and what those innovations are, working collaboratively with healthcare systems, and being a meaningful and relevant partner in that transition towards that new normal, and making sure that we stay relevant as an industry rather than becoming a commodity provider ultimately, and delivering the API into a new sort of delivery mechanism which is driven by tech. So that's sort of the challenging transition that we need to make. We need to have an integral part in the ecosystem in order to not be kicked out of the ecosystem and then knocking on the door, can I come back in, almost. Yeah. So that's where I see the danger of sort of the current situation in us pharma, if we don't move quick enough, let's put it that way.
Yeah. Raz, what's your take on this, again, from the side of actually being a technology creator provider and having innovative solutions that often customers may not have thought of before? And I know that a couple of your products are totally amazingly out there.
Yeah, well, there's two things. So as Manuel was talking, I just thought, imagine pre-pandemic, COVID, we don't know anything about it. And we said to the industry, we need a vaccine in 10 months. Right. So let's just exclude COVID. So what would the response would have been? Our processes aren't in place. We can't do it. Oh, we don't have enough data. We need to run trials for years and years.
People would have laughed and kicked you out of the room. But yeah.
Exactly. Right. but fast forward 10 months. I mean, what we've done is nothing short of remarkable. So right now we are living in these unprecedented times. We've got to acknowledge that the volume of data we're generating and have generated in the last couple of years compared to the 20 years prior will allow us to do some phenomenal things. And I think if we reflect on the last 10 months, we know now we can move at speed when all the parts aren't there or all the answers aren't there, and we can achieve something monumental. The example of that for us is, having one of our systems is about predicting the price of a drug several years prior to launch, and also predicting the benefit outcome of that drug several years prior to launch. And we looked at Germany as the market because obviously data-wise and granularity of data is there. But as I said before, even though the system was able to predict the price and the benefit outcome in about 10 to 15 seconds after you input some data, so much faster than humans, the level of resistance from value access and pricing, because these guys, many of them have done this for 30 years, and I'm simplifying it, of course. Many of them are PhDs, very, very intelligent individuals. So the level of disruption is huge, right? And I acknowledge that. And so for us to come to the market with this as a solution, it would be wrong. But to show the power of what technology can do, it's absolutely right that we acknowledge, wow, that is probably fit for the future. Is it fit for now? Probably not, because we have a journey to go on. And I think it's just acknowledging, as Manuel said, that on our doorstep, things are happening, and it's not far away. We're not in dreamland anymore. And there are many companies, not just ours, who have the capability to support that process.
Well, if there are any bosses of the market access people who don't want to lose their jobs listening in, they should give Raz a call to learn more about the solution that you talk about. Guys, I am acutely aware of time. I did promise Dario that we weren't going to go too crazy. A closing thought from each of you, perhaps, on what you think we need to do back at our desks on Monday morning. Is there any practical advice? I think you have actually given some pretty good practical steps here today, but anything that you prioritize above all else in your advice to others?
My one thing is the future is already here. It's just unevenly distributed, and we need to make them sure that we understand what the future is. And I can only encourage really everyone to make sure that they start understanding the disruptive force of tech in healthcare and its implication for the sustainability of our and efficiency of our healthcare system. And that's, I believe, it's a duty part of us as leaders in this space to make sure that society ultimately benefits from those tech benefits. It's not for the sake of tech, it's to drive fundamentally efficiencies and improve patient outcomes. That's what we're trying to achieve.
Yeah, I'll echo that. I would probably say, let's not look at, I guess, the consequences of something going wrong, i.e. base our decision on fear. So waiting for data to be perfect, the house to be in order, the data, that's never going to happen. The rate at which we're generating data, it's just practically impossible. So I would say that's the first thing. The second thing I would say is just my own experience. I've been in this industry for 20 years, and I've personally seen and probably been responsible for many pointless services and consultants that offer the same thing day after day, year after year, the same analysis. We are in the era of advanced analytics with some of the most powerful technology. No longer, and bringing a vaccine to market in 10 months is an example of this, should we be playing it safe? Of course, within the regulatory environment and all the reviews and the way that the industry is structured, but let's push the boundaries and do it together.
Indeed, let's be braver. I definitely echo those comments, Raz. There are certain things we do have to be safe for, but that doesn't mean that we can't be more courageous in many others. In fact, I would say that the sustainability of our industry depends on it. Thank you so much, guys. Massively enjoyed having you both here, and also to Maggie, who had to jump out a few minutes ago. As predicted, it was obviously the best session of today. No doubt the feedback will reflect that. So looking forward to reading that. Thank you so much, everybody. Dario, I'm not sure